So today we are going to start a new chapter, that is the contraception. Contraception is defined as the prevention of unwanted pregnancy or the avoidance of pregnancy in the presence of a regular sexual intercourse. And the contraception involves different mechanism. The first one is the contraceptive methods that inhibit the process of ovulation. Then they include combined oral contraceptive pills, progesterone only pills, and the lactational amenorrhea. The contraceptive methods that prevent the sperm from reaching the oocyte, they include sterilization. In male, the sterilization is known as vasectomy. And there are certain contraceptive methods that prevents the embryo implantation in the uterus. That include the intrauterine devices. And there are also certain contraceptive methods that allow the sperm into vagina but prevents it further passage. And they include diaphragms and the caps. And there are certain contraceptive methods which prevent the sperm into the vagina. That are the male condoms. And there are also certain spermicidal agents that kill the sperm in the vagina and prevent the conception. So to ensure the patient safety, WHO has set up a criteria known as the medical eligibility criteria. And this criteria guide whether a woman with a given medical condition is eligible to use a particular contraceptive methods or not. So there are four medical eligibility criteria. Number first is category 1. In category 1, there are no restriction on using contraceptives, and she can use the contraceptives freely. In category 2, the use of contraception outweighs its potential risk, means that there are more benefits and less risk of using the contraceptives. And category 3, there are more potential risks and less benefit, means that the use of contraception outweighs its benefits. And category 4, the contraceptive use is contraindicated, and because the use of contraception poses unacceptable health risk. So in category 4 female, the contraceptives are usually avoided. Now let's talk about the methods of contraception. The first one is the combined hormonal contraception. So combined hormonal contraception is a method of contraception that is independent of the intercourse. And the combined hormonal contraception contain combination of hormones, that is the synthetic estrogen and the synthetic progesterone. And the combined hormonal contraceptives are available in different forms. They may be available in the form of pills, in the form of transdermal patch, and in the form of vaginal ring. And the mechanism of action of combined hormonal contraceptive is they inhibit the process of ovulation, because the combined hormonal contraceptives, they include the synthetic estrogen and progesterone, and both of these hormones, they inhibit the negative feedback mechanism, and hence they prevent the release of FSH and LH from the anterior pituitary, and thus prevent the process of ovulation. And similarly, combined hormonal contraceptive pills also causes cervical thickening. They also alter the tubal mobility, and similarly they also causes endometrial atrophy. But the main mechanism is the combined hormonal contraceptive. They inhibit the process of ovulation. Now let's talk about the advantages of combined hormonal contraceptive. So combined hormonal contraceptive method is a highly effective method, and it is independent of the intercourse. And the combined hormonal contraceptives are used for the process of contraception. Apart from the contraception, they are also used for the treatment of dysmenorrhea, premenstrual syndrome symptoms. They also use for treatment of acne. They also provide the long-term protection against the ovarian cancer and the endometrial cancer. Similarly, they also use in the case of functional ovarian cyst. They also decreases the risk of endometriosis, and they also used for the treatment of irregular menstrual bleed, heavy menstrual bleed. They are also used in PCOS patient, and they are also used for treatment of endometriosis, and also in the secondary dysmenorrhea. Now let's talk about the different methods of the combined hormonal contraceptives. So the first one is combined oral contraceptive pills that are available in the oral form. So the combined oral contraceptive pills, they contain the low dose estrogen, that is the ethinyl estradiol, and they are classified by the type of progesterone they contain. And the combined oral contraceptive pills, they should be started on day one of the cycle, and they should be taken at the same time each day. And one pill should be taken daily per 21 days, followed by the 7 pill-free days. And the woman who gets symptomatic during the pill-free days, such as having the symptoms of dysmenorrhea, headache, she can take the pill continuously without 7 days of the pill-free period. The second one is the combined hormonal transdermal patch. So these hormonal contraceptives are available in the palm of patch, and the patch contain ethinyl estradiol and naltrexone, and the regime is the same as per the combined oral contraceptive pills. That is, the patch is applied for 21 days followed by 7 days of the hormone-free interval. And the site at which the patch is applied is the lower abdomen, buttocks, or the arm. But the site that is contraindicated for the patch application is breast. The third one is the combined hormonal vaginal ring. So the combined hormonal vaginal ring also contain synthetic estrogen, that is ethinyl estradiol and etonergistrel, and it is self inserted and placed in the vagina for 21 days, then followed by 7 days of the hormone free interval. Now let's talk about the missed pill guidelines. So if the one pill is missed, or if the pill is taken 24 to 48 hours later, then take the last pill miss as soon as possible and take rest of the pills as usual, and no additional contraceptive method is required. But if the missed pill are more than two, if the pills are taken more than 48 hours late, then take the last pill miss as soon as possible and take the rest of the pills as usual, and use condoms, avoid sex until 7 consecutive pills have been taken. If the missed pill was in the week one of the packet, and during this time the intercourse occur, then use emergency contraceptives. But if the missed pill was in the week two of the packet, then there is no need for emergency contraceptive method. But if the missed pill are in the week three, then directly start a new pack after the last 21 tablet without waiting for the 7 pills 3 days. Next is the missed patch and the ring guidelines. So use emergency contraceptives if the patch is not applied for 48 hours and intercourse occurred during this period. Also use emergency contraceptives if the vaginal ring is not applied for 3 hours and intercourse occurred during this period. Next one is the contraindication. So a female who fits in the medical eligibility criteria category 4, in these patients the combined hormonal contraceptives are contraindicated, and the rest the contraindications include female having uncontrolled hypertension, female having hypertension with a vascular disease, having cerebrovascular accidents, having a current or past history of stroke, those having ischemic heart disease, recent or past history of MI, those having current or past history of deep venous thrombosis, female having a current breast cancer, family history of breast cancer, those having estrogen dependent neoplasm, those having active liver disease, having a liver tumors, female whose age is more than 35 and is a chronic smoker, she is increasing risk of arterial thrombosis, female having migraine with ARA. In all these patients, the combined hormonal contraceptive pills are contraindicated. Now let's talk about the side effects of the combined hormonal contraceptives. So the first one is estrogenic side effects. So estrogen causes fluid retention by decreasing the sodium excretion, and similarly they also increases the risk of the gallstones or cholelithiasis. And estrogen also increases the HDL and decreases LDL, so which is a healthy change. And the estrogen also increases the risk of venous thrombosis, and they also increase the risk of arterial thrombosis. The arterial thrombosis, though, is rare but is more serious problem. And similarly, estrogen side effect, they also causes headache and dyspepsia. The progesteronic side effects, so the progesterone and the combined hormonal contraceptive pills, they causes mood swings and depression, they causes weight gain and acne, they also causes breast tenderness, and they decreases the HDL and increase in the LDL, which are the unhealthy changes. So the estrogen causes increase in HDL, which is healthy change, whereas the progesterone they causes decrease in the HDL, which is a good lipid. So due to decrease in HDL, these are unhealthy changes. And patients who are taking combined hormonal contraceptive pills and they are having prolonged immobility such as long distance flights, so they should do exercise during their journey, they should use graduated compression stockings, so to decrease the risk of venous thrombosis. Next is the combined oral contraceptive pills and the cancer risk. So the COCP that decreases the risk of colorectal cancer, endometrial cancer, and the ovarian cancer. But the combined hormonal contraceptive pills they increases the risk of cervical cancer and the breast cancer. Next is the progestogen only preparation. So these are the contraceptives which contain only progesterone, and they are extremely safe and can be used if a woman has cardiovascular risk factors. The mechanism of action of these contraceptives is they inhibit the implantation of the embryo because they prevent the endometrial proliferation and makes the endometrium atrophic. Similarly, they cause a cervical mucus thickening and prevent the penetration of the sperm. And the high dose progesterone preparation, they also inhibit the process of ovulation. Next is the types of progestogen only preparation. So they include progesterone only pill, subdermal implants, injectables, and the progesterone releasing intrauterine system. First one is the progesterone only pills. So the pills are ideal for the women who like the convenience of taking pills, but they cannot use combined oral contraceptive pills. And the progesterone only pills are not available in Pakistan, and they can be used in women who are breastfeeding, they are older age, having cardiovascular risk factors, they are diabetic, and having sickle cell disease. The disadvantages of the progesterone only pills include they causes irregular menstrual bleed, functional ovarian cyst, breast tenderness, acne, headache, and mood swings. Now, if a progesterone only pill is missed, then continue taking the pills plus use condom per 48 hours. But if there is a intercourse occur during this period, then use emergency contraceptives. And the condition in which the progesterone only pills are contraindicated, they include history of current heart attack, undiagnosed vaginal bleed, severely obese patient, women who have carcinoma of the breast are having molar pregnancy, women having recurrent ovarian cyst are having chronic liver disease. Next is the injectable progestogen. So they are available in the form of IM injections of medroxyprogesterone acetate, which are known as Depo-Provera. Similarly, they are also available in subcut injection form of medroxyprogesterone acetate, which is known as Cyanapres. And the mechanism of action is that these injectables inhibit the process of ovulation, and they provide contraception for 3 months, and the injection frequency is the injection is repeated after 12 to 14 weeks, and they causes amenorrhea in 50% of the women at 1 years of age. And similarly, there is another contraceptive which is known as non-administration, which is given as an IM injection, but they provide contraception for 2 months, and it is known as the Novojet. And these injectables are highly effective. They provide long-term contraception for 2 to 3 months, and they are independent of intercourse, and they can be also used to treat the painful or the heavy periods. But the disadvantage is they causes weight gain in the first year of using, and they decreases the bone mass density. And they also causes delay in the return of fertility for around 6 months to 1 year of age. So they are not appropriate for women who want short-term contraception. And there is a concern that the use of Depo-Provera increases the risk of HIV transmission. However, women who uses injectable, they are less likely to use condoms that provide protection against the HIV. Therefore, WHO now currently recommend that injection can be safely used in women living with HIV or having high risk of HIV. Next one is the subdermal implants. So these are the progesterone containing rods, and they are inserted intradermally, and they are inserted intradermally into the non-dominant arm about 8 centimeter above the medial epicondyle of the humerus, and they are inserted under local anesthesia. And the types of subdermal implants include Nexplanon. Nexplanon is a single rod of etonogestrel, and it provides contraception for 3 years. Uniplant. Uni means that it is a single rod. It is composed of non-gestural, and they provide contraception for 1 year. And the most common one is the Jadel. Jadel contains two rods that is composed of levonorgestrel, and they provide contraception for 3 to 5 years. And the side effects of the subdermal implants are the same as that of progesterone only pill, like they causes weight gain, mood swings, acne, breast tenderness, and irregular bleed initially. The advantages of the subdermal implants are they are highly effective, they provide long-term contraception, and there is a rapid return of fertility and removal, unlike the injectables. And they are suitable for the women who cannot remember taking the pills. And follow-up, the next prenon contains some barium which aids in detection with the help of X-ray or ultrasound. And no follow-up is necessary until the device is planned for replacement or the removal. Next is the progesterone releasing intrauterine device. So these are the intrauterine devices which are placed inside the uterus, and they releases progesterone, that is the levonorgestrel inside the uterus. And the types include Mirena. Mirena is commonly used, and it is a levonorgestrel intrauterine device, but it provides contraception for 5 years. Second one is the Jadis or Skyla. It is also a levonorgestrel intrauterine device, but it provides contraception for 3 years. And the mechanism of action is that it does not prevent the process of ovulation, but it releases progesterone inside the uterus, which prevent the endometrial proliferation and make the endometrium atopic, and hence prevent the implantation of the embryo. And it also thicken the cervical mucus, which prevent the entry of the sperm. The advantages of the intrauterine device, progesterone releasing intrauterine device, is that it is used as a contraceptive. Similarly, it also reduces the heavy menstrual bleed by 90% at 12 months of use. They are also used for the treatment of dysmenorrhea, for the treatment of pelvic pain associated with endometriosis and adenomyosis, and similarly, they also prevent the endometrial hyperplasia. But the disadvantages include persistent spotting and irregular bleeding during the early phase of use. They also causes acne, breast tenderness. There may be expulsion of the intrauterine device occur. There may be infection occur, that is the endometritis. And if pregnancy occur with IUCD in place, there is questionable teratogenicity, but however not reported yet. The contraindications of the progesterone releasing IUCD include pregnancy, fibroids, active infection, and hereditary palm mole.